Supporting patients undergoing treatment for lung cancer involves a holistic approach that addresses not only their medical needs, but also their emotional, psychological, and practical concerns. Lung cancer is a daunting diagnosis, and the journey through treatment can be physically and emotionally taxing. Whether you're a healthcare professional, a caregiver, a family member, or a friend, your support can make a significant difference in the patient's experience and overall well-being. First and foremost, understanding the treatment process is essential. Lung cancer treatment can include surgery, chemotherapy, radiation therapy, targeted therapy, immunotherapy, or a combination of these. Each treatment comes with its own side effects and challenges. Patients may experience fatigue, nausea, shortness of breath, pain, changes in appetite, and emotional distress. Educating yourself about the specific treatment plan and its potential impacts will help you provide more empathetic and practical support. Communication is key. Encourage open and honest conversations with the patient. Ask them how they're feeling, physically, emotionally, and mentally. Listen actively and without judgment. Sometimes patients may not want advice or solutions. They simply need someone to listen to their fears, frustrations, or hopes. Validate their feelings and let them know it's okay to feel overwhelmed or anxious. Accompanying patients to medical appointments can be incredibly helpful. Navigating the healthcare system can be daunting, especially when dealing with complex treatment regimens. Offer to help with scheduling appointments, providing transportation, or simply being there for moral support during doctor visits. Having an advocate present can make it easier to ask questions, remember medical advice, and ensure that the patient's concerns are addressed. Managing symptoms and side effects is a critical aspect of supporting lung cancer patients. Work closely with the medical team to understand which symptoms are expected and which warrant immediate attention. Help the patient track their symptoms and communicate changes to their healthcare providers. Encourage adherence to prescribed medications and assist with managing side effects such as nausea, pain, or fatigue. Simple strategies, like offering small, frequent meals to combat loss of appetite or helping with breathing exercises to ease shortness of breath, can make daily life more comfortable. Emotional support is just as important as physical care. Lung cancer can trigger a range of emotions, including fear, anger, sadness, and uncertainty. Offer reassurance and encourage the patient to express their feelings. Sometimes patients benefit from professional psychological support, such as counseling or joining a support group. Help them find resources for mental health care and encourage participation in activities that provide joy or distraction, whether it's reading, listening to music, or spending time with loved ones. Practical assistance can ease many burdens for lung cancer patients. Treatment can disrupt everyday life, making routine tasks challenging. Offer help with household chores, grocery shopping, meal preparation, or childcare. Small acts of kindness, like running errands or organizing bills, can reduce stress and allow the patient to focus on their health. If you're not sure what help is needed, ask directly or observe where support may be most beneficial. Nutrition and hydration play a vital role in the recovery and well-being of lung cancer patients. Treatments can affect taste, appetite, and digestive comfort. Collaborate with healthcare providers to develop a meal plan that addresses the patient's preferences and nutritional needs. Encourage hydration and offer nutritious, easy-to-eat foods. Sometimes, working with a registered dietitian can help manage dietary challenges and ensure the patient receives adequate nourishment. Physical activity, when possible and appropriate, can support overall health and recovery. Gentle exercise, such as walking or stretching, can improve mood, reduce fatigue, and maintain muscle strength. Consult with the medical team before starting any exercise regimen and encourage activities that the patient enjoys and feels comfortable doing. If mobility is limited, help incorporate movement in safe and manageable ways. Respect the patient's autonomy and wishes. Every individual's experience with lung cancer is unique, and their preferences regarding treatment, support, and daily life may differ. Encourage the patient to participate actively in their care decisions. Respect their choices, even if they differ from your own opinions. Empowerment and a sense of control can greatly enhance the patient's quality of life. Education about lung cancer and its treatments can dispel myths and reduce anxiety. Provide reliable information from reputable sources and help the patient understand what to expect during their treatment journey. Explain medical terms in simple language and clarify any confusing details. Knowledge allows patients to make informed decisions and prepares them for the challenges ahead. Social support is crucial. Isolation can worsen the emotional impact of cancer. Encourage connections with family, friends, and support groups. Sometimes patients may feel embarrassed or reluctant to discuss their illness. Offer reassurance and foster a supportive environment where they feel comfortable sharing their experiences. Celebrate milestones, no matter how small, and acknowledge the courage it takes to face each day. Financial concerns are common among lung cancer patients, as treatment can be expensive and may impact the ability to work. Help explore resources for financial assistance, such as insurance coverage, government programs, or charitable organizations. Offer support in navigating paperwork and understanding benefits, which can alleviate stress and uncertainty. Spiritual care may also play a role in the patient's coping process. Some individuals draw strength from their faith or spiritual beliefs. Respect their spiritual needs and offer opportunities for prayer, meditation, or connection with spiritual advisors if desired. Spiritual well-being can provide comfort and hope during difficult times. Finally, remember to care for yourself. Supporting a loved one through lung cancer treatment can be emotionally demanding. Seek support for yourself, whether it's counseling, talking to friends, or joining caregiver support groups. Taking care of your own well-being enables you to be a more effective and compassionate helper. In summary, helping patients being treated for lung cancer involves a blend of practical assistance, emotional support, education, and respect for individual preferences. By being present, offering empathy, and addressing the diverse needs of the patient, you can make a meaningful difference in their journey. Your support, whether large or small, contributes to their strength, resilience, and hope as they navigate the challenges of lung cancer treatment.